Aloha, thank you for joining us today and taking time out of your schedules to learn a little bit more about senior care services. So my name is Marcus, and I'm the Vice President of Sales Marketing / partner with Always Best Care Senior Services. So let's get started. Senior Care Services, all right? Just a quick overview about Always Best Care, which was started by local boy Tyler Kimura. It was opened on October 1st, 2021. We are part of a franchise system, which means 25 years of experience and more than 230 locations across the US and Canada. We do provide staffing services to facilities while we're waiting for our in-home care license. The third week of January 2021, we got our in-home care license. We are currently able to provide any in-home care shifts across the island with no minimum hours required. And our caregivers are documented being fully vaccinated, two-step TB, CPR certified, NA or CNA certified. If you don't know those terms, we will cover them shortly. Background checked, 2 interviews, orientation, and quality checks. All right, so major question that we like to ask is, sometimes it can be difficult to know when it's time for you or your loved one to transition into senior home care services. Often we want to think the best for our family members or ourselves to be able to stay independent for as long as possible. However, there comes a time which most seniors, loved ones, or you need help with some basic activities like bathing, dressing, cooking, or even housekeeping. If you are worried about a loved one or yourself who may need senior home care services, please keep an eye out for these signs. Activities to look for. Excuse me. Home maintenance is becoming more difficult. Such activities as sweeping, mopping, vacuuming, or any of the activities you need to keep your home clean and safe. Grocery shopping, which can become stressful, whether it be the drive there or just there's too much motion or activities going on in the supermarket, which can cause you stress or anxiety. Showing signs of memory loss, like leaving the water on at your home or forgetting to turn the light off or leaving the stove on or putting too much time on the microwave. Any of these that can affect your daily activities and quality of life. Difficulty with mobility. So this is a very key one because usually this is involving a fall risk, right? Which would be the last picture also, which is unexplained bruises or injuries because you are not paying attention or need assistance while you are mobile around your home. Options for senior care. In-home care is personal care service provided to an individual who wants to stay at home, right? The next one would be assisted living placement. This is an option for individuals who are unable to stay at home because the level of assistance can no longer be provided by the family or caregiver. A care home is a private paid care home for up to 5 individuals who are unable to stay at home. Foster care home is a government-aided home, which usually has 2 Medicaid and 1 private pay individual are allowed. Expanded adult residential care home. So they may call this an EARC, which is any facility providing 24-hour living accommodations for a fee to adults unrelated to the family. And they usually can take up to 2 wheelchairs. Independent living facility is a facility for persons who are socially and functionally independent all or most of the time. So some of the places like Kahalanui, the Plaza, or Hohainani, which is in Kaneohe. Last one will be assisted living facility, which is a facility for people who need help with daily care or ADLs, but not as much as nursing home providers. So like Haleo Miliana or Haleho'oloa are some examples of this. Now we're going to get into the ADLs. ADL stands for activities of daily living, which are the activities related to personal care. The basic ADLs include the following categories. Ambulating, which is the extent of an individual's ability to move from one position to another or walk independently. So anything regarding mobility as far as the individual. Feeding is the ability for the person to feed oneself. Dressing, the ability to select appropriate clothes and to put on clothes. Personal hygiene, the ability to bathe, groom oneself, and to maintain dental hygiene, nail, and hair care. Continence, the ability to control bladder and bowel function. Toileting, the ability to get to and from the toilet, using it appropriately, and cleaning oneself. Next one is called the instrumental activities of daily living. These are the activities that require more complex thinking skills, including organizational skills, the instrumental ADLs. So the first one will be transportation and shopping. The ability to procure groceries and attend events, managing transportation either during driving or by organizing other means of transport. Other means of transport, they have a lot of senior transport companies or people who use the handy van. Okay, managing finances. This includes the ability to pay bills and managing financial assets. Shopping and meal preparation. Everything required to get a meal on the table. It also covers shopping for clothing and other items required for your daily life. House cleaning and home maintenance. Cleaning kitchens after eating, maintaining living areas reasonably clean and tidy, and keeping up with home maintenance. Managing communication with others, the ability to manage telephone and mail. The last one would be managing medications, the ability to obtain medications and taking them as directed. Senior assistant caregivers. So these are the type of caregivers that are available for people to utilize. The first one is being a homemaker, which is basically a person who performs household chores that include housekeeping, meal planning and preparation, shopping assistance, and routine household activities for elderly or challenged individual. Nurse aide is a person who has passed a nurse aide school test to help individuals to complete tasks associated with daily life, including bathing, eating, using the bathroom, medication reminders, helping patients walk, and assisting with exercise. A certified nurse aide means a nursing assistant who has completed a federally approved training program and proved competency through testing, thereby they are entitled to be employed in a licensed healthcare facility or hospital. They can assist individuals with ADLs or IADLs at a higher hourly rate than a nurse aide. So in Hawaii, the state requires the person to only have a nurse aide certification. For the CNA certification, they need to maintain it every 2 years. If they do not recertify, then they become a nurse aide. And then that certificate is valid indefinitely, right? As long as they have taken it. So this is what is required for in-home care. So if you want a nurse aide or like a caregiver to come to your home, a nurse aide is what is required, or if not, you'll be having a homemaker or a companion. One of the key things that we always want to share with our clients is that private caregiver versus professional agency. So you hear a lot of people that they'll do caregiving for cash, $20, $25 or whatever amount that you're able to pay the caregiver. But one of the challenges that this faces is that you become the employer. So if you do hire a personal caregiver or a private caregiver, it means that you are responsible for everything from scheduling to developing a care plan, and it needs to meet the state guidelines if it gets audited. If you use the agency is responsible for scheduling, care plan, coaching, training, and managing of the caregivers. State regulations and employee screening. The client, you as the employer would need to know the state regulations regarding caregiver duties and verify experience and skill set. If you use an agency, the agency is responsible for understanding and complying with state regulations, responsible for caregiver references, skill set, and ability. Payroll, taxes, minimum wage, and overtime. This is one of the biggies, right? The client is responsible for tax laws, paying the caregiver, withholding taxes, submitting and including Social Security. If not, if you use an agency, they handle the payroll, taxes, overtime, they handled by the agency. Understanding these laws can be very complicated. You're the employer and you issue a 1099 and the employee fails to submit that, you are liable as the employer. All right. General liability is workman's comp. This is another big one. The employer is responsible for the caregiver misconduct, including medical bills in the case of injury to the employee. So if the private caregiver kicks and stuff their or breaks their toe on your chair, they can sue you, right? And basically that's gonna come out of your own pocket or under your home care insurance, depending on what the liability or what do you call that? The rule guidelines for your insurance is. Agencies are responsible for the general liability workman's comp insurance in the event of an accident or injury and accusations of misconduct also. So the agency is required to carry a very high liability insurance over $1 million or over. Background checks and drug testing. The client is responsible for background checks, reference checks, and drug screening. So the agency will do all of this for you with a criminal background check, reference checks, and a drug test of the caregiver. What is respite care? So this is a question that comes up quite a bit, and people sometimes have a misunderstanding of it. So we can clear this up for you very easily. Respite care is a special name for short-term break for caregivers. It provides short-term relief for primary caregivers, which can be arranged for just an afternoon or for several days or weeks. So an example would be a caregiver who wants to go shopping at Costco for 2 or 3 hours and leave the client at home. Then you can hire a caregiver to come and cover those couple hours while they are away shopping. Care can be provided at an healthcare facility or an adult daycare center also. The cost for respite care is usually charged by the hour from the care home agency. A lot of the care home agencies right now will have a 4 or 5 hour requirement to have them to come out and assist you. There's a question asked earlier about how to be a better caregiver. So when we talked about this, sometimes it can be common sense, but a lot of times that there's that additional level of service that you can provide to your client. The first one and foremost is always to be on time and accountable. You need to build confidence with your client. Start with small steps, provide repeated encouragement, and remember their successes. Exercise compassion. Sit, talk, and listen. Offer support verbally and physically as needed for the client. Avoid useless gestures. Try not to say things like, let me know if I can do anything, or call me if there's anything I can do. When someone is sick, they're unlikely to ask for help. So you need to take initiative to provide concrete help for that individual. Don't hesitate to act. Show you care in any and every way. You'll know by their response if you are helping or if you are not helping. Offer words of encouragement. Think of things that may have helped you through difficult situations in the past and share them. Check in often and show you care. Check in repeatedly with the person you're caring for. Educate yourself about their illness or challenges and the course of treatment that they face. The last one and most important is to take care of yourself. Take care of yourself as it's difficult to support to someone else unless you are strong yourself, meaning that you have to practice self-love and self-care, because if anything happens to you, who is going to care for that individual? All right, so moving on to Always Best Care Senior Services. Our commitment. We are dedicated to taking care of seniors. Who are we? Always Best Care combines national strength, standards, and stability with local accessibility and personal service. We're local experts in senior care, providing a resource for aging and senior living delivered through locally owned and operated offices around the country. So for our state, the person that we have in charge is Tyler Kimura. He is the owner of the Always Best Care franchise on Oahu, actually for the whole state. So he was born and raised on Oahu, graduated from Kamiki High School at UH Manoa Biology in 1996. Got his CNA, his Certified Nursing Assistant certificate on August 2021. He has a background in sales, sold Yellow Page advertising from 2001 to 2009 for Paradise Yellow Pages. He is the owner of Fresh Tropical Delights 2006 to present, where they sell fresh cut fruits. He was also an insurance agent from Allstate Insurance Agency owner from 2009 to 2018. He actually retired in 2018 and had acquired enough property where he could just basically collect rent and live happily ever after. But in 2019, he started getting restless, and then 2020, 21, he started to look at businesses to get into or run. And then he got his, like I said, in 2021, he got his CNA, and then he opened Always Best Care Oahu on October 1st, 2021. So he also did real estate development, investments, long-term rentals, and now he's the owner, home care agency owner of Always Best Care. Marcus Sinomini, Vice President, Sales and Marketing Partner. So born and raised on Oahu, graduated from Kaiser High School and UH Manoa BBA in Marketing Management in 1994. He was a caregiver to his grandma Yai from March 1997 to 2001. Background in sales and customer service for more than 30 years. Business, English, and life coach for more than 12 years. Marcus is determined about providing the highest level of sales, engagement, and customer service for our kupuna and loved ones. Tatagi Polito. She is the Director of Operations and Scheduling. So this is what she had to share. My name is Tatagi Polito. Most people call me Tita because it's easier to pronounce. My first job was helping seniors with long-term care and estate planning. I was amazed at the stories that they would tell when we had conversations. They are part of the greatest generation and deserve our love, compassion, and respect. I am proud to be part of this industry and will treat all as I would like to be treated. Maylee Costello, she is our staffing coordinator. So she hires and recruits all of our CNAs, NAs, and homemakers. She says, aloha, my name is Maylee Costello. I'm born and raised on Oahu, and I've always been passionate in helping others. One of my jobs was working with the elderly and identifying gaps in their Medicare coverage. During this process, I saw a need for care for our elders. Here I am helping to provide caregivers for our clients. I'm so grateful to be part of Always Best Care and can be a part of the team that wants to be the best care for our seniors. So Always Best Care is a continuum for all, anytime, any place, anywhere. Our first and foremost service is in-home care services. So we really love to send caregivers and homemakers out to people's home, and for those people who want to stay at home and provide them with the support and resources for them to do so. Next, what we do is placement services. So we do assisted living placement. We call it long-term placement, where we can help you to find a care home or facility to stay at when staying at home is no longer an option or it becomes a little bit too much for the family or cost-wise as far as bringing caregivers in. Staffing for facilities. So Always Best Care has done very well for staffing for facilities. We went out and we got 4 facilities, and basically within a short period of time, another 10 or 11 came and asked us for help. And we'll show you some of those facilities shortly afterwards. Why do people choose us? People always choose Best Care because of these top 5 factors that set home care agencies apart. So number 1, caregivers, high quality. So like I said, at Always Best Care, because we're part of a franchise system, we have to vet our caregivers through a very thorough process, meaning that they're fully vaccinated, they have 2-step TB, they have CPR certification, they have to have their NA certification or CNA certification, or they can actually start off as a homemaker companion, and then we'll normally take the class to become an NA and then possibly a CNA afterwards, right? So, and then also when they come to us, they have a background check, 2 interviews, orientation, and then quality assurance checks, meaning we check with the clients to make sure that they're happy with the caregiver that we sent, and the caregiver is happy with the client also. 24/7 availability. So one of the things that sets Always Best Care apart is that we answer our phones 24/7, 365 days a year. So when you call the main number, all of our phones ring. So even on the weekends, we pick up the phone, and this has enabled us to help the kupuna and loved ones who need it also, because senior care is a 24/7 job. So client satisfaction, provide proof of happy clients. The numbers speak for itself, meaning our agency has done, we're actually number one for always best care in the nation, bringing in revenue, over a seven-digit revenue the first year for the company. Exceptional customer service. So customer service, meaning that we go above and beyond usually what is required by agencies. We have onboarding, which actually the client manager can pick up or drive the caregiver to the client's house and introduce them rather than a stranger show up to your house. So it's like a seamless passing and introduction to the caregiver, and then the client manager has already gone over all of the requirements or assistance that is needed for that individual. Professionalism of the agency. Because we're branded with a franchise, we have to follow very specific guidelines on how we conduct ourselves, the people that we hire, and how we move forward with the branding for the company. So this is why people choose us at Always Best Care. What makes our caregivers special? Recruiting, training, and retaining. So with Always Best Care Oahu, we have 3 competitive advantages. We have hierology, we have Care Academy, and we do caregiver background checks. Because we are a franchise system, we have a lot of access to software and resources that many of the other agencies do not have, or do not have the availability to use it. So with our company, we do have that, and that gives us a serious advantage as far as hiring caregivers with Aloha. Free living and referral services. So we do match our clients with the most appropriate living options. So assisted living placement based on their individual needs, desires, and budget. Let us help you today. So if your in-home care gets too much for your family, or the cost for the caregivers coming so much to the house is not feasible, then we can actually fill out a questionnaire, and then we can match you with a care home or facility that would best be suited to your needs and requirements. These are some of the facilities or clients that we're currently working with: Hale Omeleana and Pearl, Lunalula Home Daycare, Rehab Hospital of the Pacific, UHA, as well as Hale Ho'aloha, and about 10 others. So for staffing requirements, we are able to staff a lot of these facilities. One of the things that will give you peace of mind if you work with us for in-home care is that we're able to cover 95 to 98% of our in-home care, because if it is necessary, we can pull a caregiver from the facilities to cover the in-home care, because facilities can run short. But if you're talking about in-home care, you have that individual that has been waiting to take a bath for 3 days, so it's quite important for the caregiver to show up. Valuable consumer programs. So Always Best Care really believes in helping the consumers as well as the clients. We have an Always in Touch program, which is a CSR program, which is designed to keep people engaged and active. So if they're unable to use our services, or no one's able to help them, we will have a person from our company call them up on a daily or weekly basis to engage them for about 10 or 15 minutes, or whatever time frame that is allocated. We also have a balance tracking system. So this is a software and technology product that measures the fall risk of an individual. So we can actually stand you on something like a scale, and then it measures your balance on which side you may be most prone to fall, whether it be left, right, front, or back. So this can be very useful in giving information to the caregivers on how they can monitor and assist their clients. Lifeline Alert, we also sell that, but that's a lot of people pick them up on their own. That's when you fall or are unable to get help, then it alerts a national center and they can make the calls for you. Veterans programs. We offer veterans programs and assistance, and we're actually directly contracted with the VA already. So we're one out of 8 out of 70 home care agencies that is contracted with the Department of Veterans Affairs. And then also we are a trusted partner of a company called Give Me a Break, which is a nonprofit for caregivers. So we talked about self-love and self-care. Give Me a Break actually sends like masseuses and estheticians to like a facility to give the caregiver a massage or do their nails while on their break to help them have self-care. Always in the news. So basically, for Always Best Care, because we are a national franchise, we have the ability to be engaged with being top of mind awareness, like National Minority Franchising Initiative, USA Today, Best Franchise for Veterans Military Times Edge, and Top 50 Franchise Satisfaction Awards, Franchise Business Review, as well as Top Franchise for African Americans, Black Enterprise Magazine. So with our company being a national franchise, we're always out and about or a top of mind presence because we're in the news. Giving back to our community with our trusted partner. So like we mentioned earlier, Give Me a Break is a nonprofit ran by this amazing lady named Sabi Makalena, and she really believes in helping taking care of the caregivers. So on this past Thanksgiving, we take Thanksgiving dinners to caregivers and their clients who are unable to partake Thanksgiving dinner with their families. So we actually deliver a Thanksgiving dinner to anybody who needs assistance or would like a Thanksgiving dinner on that day. Free Always Best Care local newsletters. So educational tips, resources are all available to you, and there's a free sign up, and we can send this information to you. You can see my contact information and email at the end of this presentation, and you can let me know and I can get you signed up or connected with these free informational resources for senior care. Services that we offer. So one of the things that we want to really share with you is that, like I said, our mission is to help take care of the seniors and provide the best level of care for our kupuna and loved ones. So with Always Best Care, we do offer 24-hour accessibility, meaning we answer our phones 24/7, 365 days out of the year. We're 100% locally owned and operated with tremendous background support from our parent company, who has over 25 years experience in home care. In home care, we provide caregivers to those who want to stay at home, assist with daily activities, transportation, light housekeeping, meals, medication reminders, etc. Assisted living placement, assist seniors in finding the appropriate care home or senior community when they can no longer safely live at home. Advanced technology. So this is one of the things that through our online portal, the Family Room, you can stay connected and informed with your loved ones through our online portal. So this is basically email that will allow you to see which caregiver is coming and then what time they're coming from, and gives you a little bit information about the caregiver, and then also the tasks that they are required to do while they are at taking care of your loved one. So if it says about bathing, then it's gonna have a task for bathing and they have to check it off when it's done. That we can see what processes are being done, even if you're not at the home yourself. So this is especially convenient for family members that are living on the mainland or abroad and are not with their parents. It's a way that they can have up-to-date information regarding the care of their parents through this Family Room online portal. Caregivers with proper credentials. Like we mentioned before, this is something that is very key and important because you want to make sure that you have a caregiver that has the skill set to take care of your loved one. With Always Best Care, we will only provide caregivers who are properly credentialed. So nurse aid training, 2-step TB tested, COVID-19 vaccinated, CPR certified, and background check. For some of the agencies, unfortunately, they do not follow these guidelines or they're not properly credentialed. So unfortunately, they are not able to work with us as we have caregivers from other agencies coming to work with us. But because we follow very strict guidelines, we are unable to hire them. We also provide extensive training for new caregivers prior to one-on-one. So this is invaluable because when a caregiver goes to a facility, 1 day in a facility is equal to 1 month of in-home care because they're working with anywhere from 8 to 15 clients, bathing, toileting, transferring, dressing, grooming, all in 1 day. Whereas with in-home care, you usually only have one client that you're working with, so it's much more easier or manageable. Extensive training, partnerships with fiduciaries, Medicare brokers, Medicaid consultants, attorneys, and financial planners. Because of the industry we're in, we already formed partnerships with many other companies or businesses in the field to point you in the right direction. So it's not our expertise because we are a private pay and long-term care provider, home care provider, then we can refer you or point you in the right direction for companies to work with in regards to your needs. Word on the street speaks for itself. So you can go to our website, you can see a lot of testimonials. We actually get a lot of referrals from our current clients. So some of the things that people are saying about us is, first one is, have had very excellent caregivers through the services of Always Best Care. They are quick thinking professionals. I feel this company is trustworthy and dependable. This is from Norma P. in Echo Beach. Always Best Care is responsive and reliable. Michael S. from Kapolei. My experience was professional and highly beyond any expectations. Roxanne K. from Kaneohe. The staff shows up on time, every time, and are very professional and resourceful. My husband is in the best hands when I'm not available. He feels safe and comfortable. And this is coming from a former nurse who's in Honolulu, and she's been our client for more than a year. All right. Our team and caregivers at Always Best Care have been so wonderful. My grandma loves them all so much, and we definitely feel like we are part of the family. Without hesitation, I highly recommend choosing ABC above all the rest. Rory L., Honolulu. So you can see from a lot of the local people that we're currently working with that we have developed a good reputation as well as providing hopefully caregivers with Aloha to the people who need them. So let's get started today. With our company, actually, we do a personal care consultation or assessment for free. Then we provide caregiver matching. So one of the things that a lot of people ask is that, when they have a caregiver, is it going to be the same caregiver coming all the time? The answer to that is, unfortunately, that is not the case, meaning that it's called caregiver matching. So when we first start off our services, we can't promise that things are going to run smoothly. We can't promise that we will address any challenges or situations. So in the beginning, when we find a caregiver, at Always Best Care, we allow our caregivers to pick and choose the shifts that they want. And what this helps with is that it lowers the amount of call-offs or no-shows. So when the caregivers pick and choose their shifts, it's usually closer to their home and they can get the pay rate that they want also. So this is significant because we will not force or coerce any caregivers to take any shifts, but we will beg, plead, grovel, and bribe them in order to take the shift. So once they find a client that they like, they will take all the recurring shifts. If they're not so fond or their schedule doesn't permit, then they may take that and they may go to other shifts. So the key thing is that when you, if you treat your caregiver well or with courtesy and respect, then that will encourage them to come back and work with you as far as a family and client. And this will make the recurring shifts and you can have a regular caregiver on a continual basis. Streamlined enrollment. So everything we do is software based. So we actually write paper and then we can input it into the system and then everything is tracked afterwards. And we do have auto payment. This is the Always Best Care first annual Christmas party. So you can see that we have a significant amount of people already. So we are able to, right now we're running with about 170 caregivers, and about 8 admin. And the company is doing very well and continually growing. So mahalo for your time. And